Dyslipidemia, and in particular the contrast of LDL cholesterol, represent, of course, the main intervention for reducing cardiovascular risk. But beyond LDL target, we have now a number of emerging new targets that are under investigation at the moment, and probably in the next future we will have a bigger landscape for intervening in lipid disorders. I'm referring in particular to the new therapy for Lp(a) reduction that are currently under investigation in CVOT trials. These trials have been conducting since last years, and they are still ongoing. That means that they were not interrupted for futility. That is, of course, promising for a clinical point of view. And therefore, I believe that in the near future, our treatment of dyslipidemia for reducing cardiovascular risk will be much larger and much more comprehensive than we do now. The critical point is that when we look at reducing LDL, even if we go very, very low with LDL, as we did, for instance, in the trial with the PCSK9 inhibition, we see that still remains a considerable amount of residual risk. And also we have data that other parameters like triglyceride, like non-HDL cholesterol or ApoB, are predictive of cardiovascular events even in patients with low LDL. That means that suggests at least that by looking and focusing on other parameters like Lp(a) or triglyceride, etc., we can also get some benefit from intervening in the lipid context, but to other targets. We have good evidence, as the last guidelines have very well reinforced, that LDL is not only a marker of risk, is a causal factor of atherosclerosis. LDL is the main driver of the atherosclerotic process, and this is very important, of course, to sustain the intervention on LDL and to, of course, make policy for a robust investment on this, in this regard. But we also have now evidence that other particles, for instance, Lp(a) or the triglyceride themselves, they can directly contribute to the process of atherosclerosis. In other words, they also may have, and we have a number of experimental, mostly experimental evidence that this is the case, a causative role in promoting the atherosclerosis and in developing the transition from stable disease to vulnerable patients.